Grapefruit is commonly praised for its heart protective properties, rich in vitamin C, potassium, and antioxidants. It's often recommended for adults managing cholesterol and blood pressure. However, for individuals over 60, especially those on daily medications, this fruit may present hidden risks, particularly for joint and bone health. In this video, we'll examine how grapefruit's interaction with certain drugs may increase the likelihood of joint discomfort, and what safer dietary alternatives exist for seniors. Why grapefruit is considered heart-healthy. Grapefruit is widely regarded as a beneficial fruit for cardiovascular health, especially among older adults aiming to manage blood pressure, cholesterol, and oxidative stress. Its reputation as a heart-friendly fruit stems from its dense nutritional profile, which includes vitamin C, potassium, dietary fiber, and a class of bioactive compounds known as flavonoids. Among these, naringin and naringenin have been most studied for their vascular and antioxidant effects. Vitamin C in grapefruit supports the integrity of blood vessel walls by aiding in collagen synthesis and protecting cells from oxidative damage. This is particularly important for seniors, as oxidative stress increases with age and contributes to arterial stiffening, a known risk factor for hypertension. Potassium, another key mineral in grapefruit, helps balance sodium levels in the body and supports proper heart rhythm. In individuals over 60, potassium intake is especially relevant, as age-related changes in kidney function and diuretic use can increase the risk of electrolyte imbalance and blood pressure fluctuations. A systematic review published in the Journal of Agricultural and Food Chemistry 2013 concluded that regular citrus consumption, including grapefruit, was associated with modest reductions in systolic and diastolic blood pressure. Another study, published in the American Journal of Clinical Nutrition 2006, found that dietary intake of flavonoids like naringenin was inversely related to the incidence of coronary artery disease in older adults. These findings have contributed to grapefruit being recommended in dietary patterns such as the DASH diet, dietary approaches to stop hypertension, which emphasizes fruits high in potassium and low in sodium for blood pressure control. Moreover, grapefruit's soluble fiber mainly, pectin has demonstrated cholesterol-lowering effects by reducing LDL concentrations and improving lipid profiles. A clinical trial published in Metabolism 2006 showed that participants who consumed fresh grapefruit daily for 30 days experienced significant reductions in total cholesterol and LDL, especially among those with hyperlipidemia. This makes grapefruit a logical inclusion in heart-healthy meal plans aimed at preventing or managing atherosclerosis, a condition characterized by plaque buildup in the arteries and a major contributor to cardiovascular events in aging populations. The appeal of grapefruit for heart health also lies in its low glycemic index and low calorie density, which make it a favorable option for older adults with coexisting metabolic concerns, such as obesity, insulin resistance, or type 2 diabetes. By contributing to blood sugar regulation and supporting satiety, grapefruit can be a strategic addition to weight-conscious dietary regimens that aim to reduce cardiovascular strain. However, while these benefits are well established in the literature, they must be weighed against grapefruit's lesser-known potential to interfere with drug metabolism, particularly in populations with high medication use, such as adults over 60. The majority of health guidance surrounding grapefruit focuses exclusively on its cardiovascular advantages, with limited public awareness of how it may disrupt other physiological systems when combined with common prescriptions. In summary, grapefruit offers several scientifically supported cardiovascular benefits, including improved endothelial function, antioxidant protection, and favorable effects on blood lipids and blood pressure. Its nutrient composition makes it an attractive option in heart-healthy diets for older adults. Yet, This fruit's interactions with medications and potential effects on joint and bone health underscore the need for a more nuanced understanding. For seniors, managing multiple health conditions with pharmacologic treatments, grapefruit's benefits must be carefully considered in the broader context of individual health status and medication regimen. Grapefruit's effect on medication metabolism. While grapefruit is widely recommended for cardiovascular support, it also contains naturally occurring compounds that can interfere with how the body processes many prescription medications. The primary concern lies in a group of phytochemicals known as furanocoumarins, which are abundant in grapefruit and some other citrus fruits. These compounds inhibit the activity of cytochrome P450, 3A4, CYP3A4, an enzyme found in the small intestine and liver that plays a key role in metabolizing approximately 50% of all clinically used drugs. When CYP3A4 is inhibited, certain medications are not broken down at the expected rate, leading to increased systemic exposure. In other words, the drug stays in the body longer and at higher concentrations than intended, even if the dosage remains unchanged. This effect is not theoretical. It's been confirmed in both pharmacokinetic studies and real-world clinical cases. A pivotal study published in the Canadian Medical Association journal Bailey et al. 2012 reviewed over 85 medications affected by grapefruit and concluded that in some instances, the presence of grapefruit juice tripled or quadrupled plasma drug concentrations, potentially turning a therapeutic dose into a toxic one. The U.S. Food and Drug Administration (FDA) also maintains a list of medications known to have significant interactions with grapefruit. This includes commonly prescribed drugs in older populations, such as statins, G, atorvastatin, simvastatin, antihypertensives, E, G, felodipine, immunosuppressants, A, G, cyclosporine, and several medications used to manage pain, inflammation, or osteoporosis. When combined with grapefruit, these drugs may exhibit enhanced pharmacologic effects or adverse reactions, particularly in individuals over 60 who often take multiple medications concurrently. For example, Linda, 72, had been managing her blood pressure and cholesterol with felodipine and simvastatin for several years without issue. After adding half a grapefruit to her breakfast routine, something she read was heart-healthy, she began experiencing unusual dizziness, muscle soreness, and swelling in her ankles. Her doctor later confirmed that these symptoms were likely due to elevated drug levels caused by grapefruit's suppression of CYP3A4, leading to dose-dependent side effects. The severity of the interaction depends on several factors: the specific drug involved, the extent of its first-pass metabolism, and the amount of grapefruit consumed. Even small servings, such as 200–250 millimoles of juice, or half a fresh grapefruit, have been shown to produce clinically relevant effects. Importantly, the impact is not consistent across individuals, as intestinal CYP3A4 expression varies by person, meaning some older adults may be more vulnerable than others without being aware of it. The timing of consumption also matters. Furanocoumarins in grapefruit can inhibit CYP3A4 for up to 24–72 hours, meaning that spacing the fruit and medication several hours apart does not necessarily eliminate the risk. This is a common misconception, particularly among seniors who believe that eating grapefruit in the evening is safe if medication is taken in the morning. Unfortunately, enzyme inhibition can persist long after the fruit has been digested, maintaining the potential for drug accumulation over time. Another layer of complexity lies in the fact that grapefruit also affects P-glycoprotein (PGP), a transporter protein that regulates the absorption and distribution of certain drugs. Inhibition of PGP can further enhance drug absorption beyond CYP3A4 effects. According to a 2016 report in Pharmacology and Therapeutics, the dual impact on both enzyme and transporter systems increases the unpredictability of grapefruit drug interactions, especially in polypharmacy patients. It is worth noting that not all citrus fruits pose this issue. Oranges, lemons, and tangerines do not contain the same levels of furanocoumarins as grapefruit. However, Seville oranges and pomelos, sometimes used in marmalades or exotic citrus drinks, can also inhibit CYP3A4 and should be approached with similar caution. In clinical practice, healthcare professionals rarely recommend complete avoidance of grapefruit unless a patient is on a narrow therapeutic index drug. Still, for older adults who are managing multiple chronic conditions and taking daily medications, the safest approach is to treat grapefruit as a potentially interacting food and consult a pharmacist or physician before including it regularly in the diet. To summarize, grapefruit alters how the body metabolizes many prescription drugs by inhibiting intestinal enzymes and transporters, leading to elevated drug levels and an increased risk of adverse effects. This is especially relevant for seniors, whose medication regimens are often complex and whose metabolic capacity may be naturally reduced due to age. While the fruit may appear harmless, its interaction with commonly prescribed medications makes it a noteworthy consideration in geriatric nutrition and pharmacology. How grapefruit may affect joint and bone health. While most public awareness around grapefruit interactions focuses on blood pressure or cholesterol medications, the lesser-known effects on joint and bone health are equally relevant, particularly for adults over 60 who often manage age-related musculoskeletal conditions. Many medications prescribed for inflammation, arthritis, and osteoporosis are also metabolized through the CYP3A4 pathway or influenced by transporter proteins, such as P-glycoprotein. When grapefruit interferes with these systems, the results can lead to exaggerated drug exposure, intensifying side effects that directly affect joint comfort, mobility, and bone integrity. One common drug class impacted is corticosteroids, including prednisone and methylprednisolone. These medications are widely used in managing rheumatoid arthritis, polymyalgia rheumatica, and chronic joint inflammation. Though effective in reducing inflammation, corticosteroids are known to accelerate bone demineralization and muscle catabolism, particularly with long-term use. A 2017 review in Osteoporosis International emphasized that corticosteroid-induced osteoporosis is a leading cause of fragility fractures in seniors. When grapefruit inhibits the metabolism of corticosteroids, it can amplify their systemic effect, leading to higher than intended steroid levels. This may manifest as increased joint stiffness, water retention, muscle weakness, or bone thinning, all of which can reduce physical function and increase fall risk. For instance, Gerald, 74, had been taking prednisone to manage inflammatory arthritis. After switching from oranges to grapefruit at breakfast, thinking it was a healthier choice, he began noticing more swelling in his knees and reduced leg strength. His rheumatologist later identified grapefruit as a possible contributing factor to elevated steroid levels and advised discontinuation. In addition to corticosteroids, grapefruit may interact with selective estrogen receptor modulators, SERMs, and bisphosphonates, used for osteoporosis management, such as alendronate or risdronate. While grapefruit's influence on these medications is less about enzyme inhibition and more about absorption interference, it still raises concern. These medications require precise intake conditions, often on an empty stomach with plain water, and any deviation can reduce their bioavailability. According to a 2019 clinical guideline from the Endocrine Society, impaired absorption significantly reduces the anti-fracture efficacy of bisphosphonates in older adults. The risk is not only diminished treatment effectiveness, but also misleading signs of disease progression. If bone loss appears to continue despite therapy, clinicians may escalate dosage or switch drugs unnecessarily, when in fact, the issue lies in food-drug interaction. This is particularly relevant for postmenopausal women, who often rely on these medications to preserve bone density. Another consideration involves statins, particularly simvastatin and atorvastatin, which are frequently prescribed to seniors for lipid control. Although statins are not intended to target joint health, muscle and joint pain are known side effects, especially when blood concentrations rise above target levels. A 2013 study published in JAMA Internal Medicine found that grapefruit juice significantly increased the plasma concentration of simvastatin, raising the risk of myopathy, joint discomfort, and mobility limitations in older adults. In seniors, distinguishing between medication side effects and age-related joint degeneration is often challenging. When symptoms like morning stiffness, joint swelling, or reduced walking tolerance appear, or worsen without an apparent cause, it may not be the underlying disease, but rather the interaction between diet and medication. Moreover, chronic use of medications affected by grapefruit may lead to cumulative strain on weight-bearing joints, indirectly influencing posture, gait stability, and physical independence. Given that joint degeneration and bone fragility are already elevated in this age group, any avoidable factor that worsens these conditions, such as dietary interference, should be carefully managed. It's also important to recognize that the variability in individual CYP3A4 expression makes it difficult to predict who will experience these side effects. Some older adults may metabolize these medications efficiently despite grapefruit intake, while others, due to genetics, age-related liver function decline, or polypharmacy, may see disproportionate effects. In conclusion, while grapefruit offers proven benefits for cardiovascular health, its indirect influence on joint and bone health via medication interaction is a valid clinical concern for adults over 60. Seniors taking corticosteroids, bisphosphonates, statins, or hormone-related treatments should discuss grapefruit consumption with their healthcare provider. Adjusting diet may not only enhance drug safety, but also protect joint integrity and preserve mobility, key priorities in geriatric care. Interference with osteoporosis treatment. In addition to its effect on anti-inflammatory drugs, grapefruit may also compromise the effectiveness of osteoporosis medications, particularly bisphosphonates, which are a mainstay in managing age-related bone loss. These drugs, such as alendronate fosamax, risdronate actinol, and ibandronate beniva, are commonly prescribed to postmenopausal women and older adults at risk of fractures. Unlike other medications, bisphosphonates have strict administration requirements. They must be taken with plain water, on an empty stomach, and patients must remain upright for at least 30 minutes after ingestion. Even minor deviations from these instructions can impair absorption. While grapefruit does not directly inhibit CYP3A4 in the case of bisphosphonates, its acidity and bioactive compounds may interfere with gastric pH and delay gastric emptying, reducing the drug's bioavailability. A study published in Bone Reports 2018 emphasized that food interactions, especially with acidic beverages or citrus juices, could reduce absorption by up to 60%, potentially rendering the medication subtherapeutic. This poses a significant issue for seniors, as untreated osteoporosis can progress silently, only becoming apparent after a fracture occurs. Furthermore, grapefruit's interaction with the P-glycoprotein (PGP) transporter may indirectly impact how some bone-modulating agents are distributed or cleared. Although data on grapefruit bisphosphonate interaction is limited compared to statins or calcium channel blockers. The pharmacokinetic unpredictability in older adults with multiple comorbidities warrants caution. Clinical guidelines, such as the Endocrine Society's 2019 Clinical Practice Guideline on the treatment of postmenopausal osteoporosis, stress the importance of strict adherence to dosing instructions. Any interference with timing, gastric environment, or co-consumed substances like grapefruit may not only reduce therapeutic benefit, but also lead to inappropriate escalation of treatment, such as switching to more aggressive or injectable alternatives due to perceived treatment failure. A practical example can be seen in Denise, 69, who had been prescribed weekly alendronate following a DEXA scan showing osteopenia. Despite regular dosing, a follow-up scan after 12 months showed further bone loss. Upon review, it was found she had been drinking grapefruit juice each morning within 30 minutes of taking her medication, contrary to administration guidelines. Her endocrinologist concluded that the juice likely interfered with the absorption window, and the issue was addressed through patient education and revised timing. In addition to bisphosphonates, grapefruit may also affect newer classes of osteoporosis medications, such as SERMs, selective estrogen receptor modulators like raloxifene. While the interaction here is less well documented, raloxifene is partially metabolized via glucuronidation, a process that may still be influenced by grapefruit's modulation of intestinal transport mechanisms. A 2015 study in clinical pharmacokinetics noted that older adults with polypharmacy are especially susceptible to variable absorption due to overlapping enzyme and transporter interactions. Moreover, for seniors using calcium or vitamin D supplements, grapefruit is often assumed to be safe. While it generally does not interfere directly with these supplements, combining calcium-rich foods or supplements with grapefruit-containing breakfasts may disrupt the absorption kinetics of other co-administered medications, particularly those requiring an acidic or alkaline environment. The concern is less about toxicity and more about cumulative inefficiency in nutrient and drug uptake, which over time may affect bone remodeling dynamics. Given the chronic nature of osteoporosis treatment, often spanning years, the impact of even small, consistent reductions in drug absorption can be significant. Reduced bone mineral density, delayed response to therapy, or unexplained fractures may not always reflect disease severity, but rather subtle interference from dietary habits, including grapefruit consumption. In summary, while grapefruit does not always produce direct toxic effects on osteoporosis medications, it poses a meaningful risk of reducing drug efficacy through absorption interference and transport modulation. For older adults who rely on strict dosing adherence for bone protection, avoiding grapefruit or separating its consumption from medication by at least 24 hours is a precaution worth considering. Consulting a healthcare professional to tailor dietary timing around osteoporosis therapy can help maximize treatment outcomes and reduce unnecessary medication adjustments. Who should be especially careful? The potential for grapefruit to interfere with medication metabolism is not uniform across the population. However, certain groups, particularly adults aged 60 and above, are at significantly higher risk due to the prevalence of polypharmacy, age-related metabolic changes, and the types of medications typically prescribed in this age bracket. Recognizing who is most vulnerable is essential for reducing avoidable adverse events and optimizing therapeutic outcomes. Data from the National Center for Health Statistics 2020 shows that approximately 90% of adults aged 65 and older take at least one prescription medication daily, and over 50% take 5 or more. Among these, a substantial proportion includes drugs known to interact with grapefruit, such as statins, antihypertensives, corticosteroids, and bisphosphonates. The risk is further compounded by reduced hepatic and renal clearance in older individuals. meaning drug accumulation occurs more easily when metabolism is altered. Seniors prescribed statins, especially simvastatin, atorvastatin, and lovastatin, are particularly susceptible. A 2013 analysis published in JAMA Internal Medicine found that grapefruit juice can increase simvastatin blood levels up to 7-fold, which substantially raises the risk of myopathy, joint pain, and hepatic strain. For individuals already experiencing mild musculoskeletal discomfort due to aging, this can result in a noticeable decline in function and quality of life. Equally at risk are patients with rheumatic or autoimmune joint conditions who use prednisone or other corticosteroids long-term. These individuals often already face accelerated bone loss and muscle wasting. When grapefruit inhibits the metabolism of corticosteroids, systemic levels rise, further exacerbating osteopenia, joint stiffness, and glucose intolerance. The long-term consequence may be early-onset frailty or increased fall risk. For example, Nora, 68, managing polymyalgia rheumatica with daily prednisone, began experiencing blurred vision and hip discomfort after adding grapefruit juice to her morning routine. Her physician identified the interaction and adjusted both her medication schedule and diet to avoid further complications. Postmenopausal women on osteoporosis treatment are another high-risk group. As mentioned in Part 4, bisphosphonates like alendronate require precise absorption conditions. Disruptions caused by grapefruit or other acidic beverages can render these medications less effective, undermining long-term fracture prevention efforts. In individuals with a history of vertebral or hip fractures, any reduction in medication efficacy is clinically significant. A review in Drugs and Aging 2019 emphasized that food-drug interactions remain one of the most overlooked causes of treatment failure in osteoporosis management, especially among unsupervised seniors. Individuals taking multiple medications, simultaneously referred to as polypharmacy, face an amplified risk due to cumulative interaction potential. Even if grapefruit affects each medication modestly, the combined pharmacodynamic impact can lead to fatigue, dizziness, muscle weakness, and poor balance symptoms that may be incorrectly attributed to aging itself rather than preventable drug-food interactions. Furthermore, patients with chronic kidney or liver disease, common in the elderly, often exhibit reduced enzyme activity even in the absence of grapefruit. The addition of enzyme inhibitors like furanocoumarins may tip the balance toward toxicity. Clinicians treating patients with hepatic insufficiency, congestive heart failure, or diabetes should take extra care when reviewing dietary habits, particularly regarding citrus intake. It is also important to note that not all interactions are clinically obvious. Some may emerge gradually, such as unexplained fatigue, joint soreness, or slowed recovery from minor injuries, and may not prompt immediate investigation. These symptoms are often misattributed to aging or disease progression. Healthcare providers should consider dietary habits, especially regular grapefruit consumption, as part of routine medication reviews for older adults. In terms of patient education, awareness remains limited. A survey conducted by the FDA in 2018 indicated that less than 30% of adults over 60 were aware that grapefruit can interfere with medications. Even fewer could identify which medications are involved. This highlights a pressing need for accessible, science-based education, targeting both patients and caregivers. In summary, individuals over 60 who are taking statins, corticosteroids, osteoporosis medications, or any long-term prescriptions metabolized by CYP3A4 should be cautious with grapefruit intake. The potential for increased drug levels, diminished treatment efficacy, and added strain on musculoskeletal health makes this a critical but under-discussed aspect of senior care. Proactive communication with healthcare providers about diet and drug timing can help reduce risks and ensure both heart and bone health are preserved safely. Safer fruit alternatives for seniors. For older adults who wish to maintain both heart and bone health without the risk of medication interference, there are several safer fruit options that offer comparable nutritional benefits without the enzyme-inhibiting effects of grapefruit. These alternatives support cardiovascular function, reduce inflammation, and promote skeletal health while being far less likely to interact with common prescription medications. Blueberries, for example, are rich in anthocyanins, potent antioxidants, known to support vascular integrity and reduce oxidative stress. A study published in the American Journal of Clinical Nutrition 2019 found that daily consumption of blueberries improved endothelial function and lowered systolic blood pressure in older adults. Importantly, blueberries do not affect the CYP3A4 enzyme system and are considered safe for those on statins or antihypertensives. Kiwi fruit is another excellent choice. High in vitamin C and potassium, it supports collagen synthesis in joint tissue and helps maintain electrolyte balance. Additionally, kiwis have been shown to improve gastrointestinal function and aid in the absorption of certain nutrients without interfering with drug metabolism. For seniors on osteoporosis medications, kiwi fruit can be safely consumed at times well separated from bisphosphonate intake. Pears are particularly helpful due to their high fiber content and low acidity. They support digestive health and have anti-inflammatory properties. Unlike grapefruit, pears do not contain furanocoumarins and do not influence intestinal enzyme activity, making them a low-risk option for seniors taking multiple medications. Other low-risk fruits include apples, plums, and watermelon, all of which are hydrating, nutrient-dense, and safe to consume alongside most prescription drugs. The key is not to eliminate citrus fruits entirely, but to select those with minimal interaction potential. Oranges and tangerines, for instance, are generally safe alternatives and do not carry the same inhibitory effect on CYP3A4. For seniors who enjoy grapefruit, the best approach is individualized consultation with a physician or pharmacist. In some cases, medication timing can be adjusted, or an alternative drug may be prescribed that is unaffected by grapefruit. However, this decision should be made with professional guidance and not based solely on general nutrition advice. Grapefruit remains a nutritious fruit with proven benefits for heart health, but for adults over 60, especially those managing chronic conditions with daily medication, it presents real and measurable risks. Its potential to alter drug metabolism and absorption should not be overlooked, particularly when joint and bone health are already vulnerable. Understanding the interaction between diet and medication is a critical part of healthy aging. A food that supports one system may quietly compromise another. In the case of grapefruit, this trade-off becomes particularly relevant for those taking statins, corticosteroids, or osteoporosis treatments, where even modest disruptions in drug levels can lead to serious long-term consequences. If you're over 60 and taking regular medication, consider reviewing your fruit choices as part of your overall care plan. Choose alternatives that nourish your heart, protect your bones, and respect the role of your medications. If this video helped you make more informed health decisions, please consider subscribing to Radiant Health 60. We offer clear, science-based insights tailored for seniors who want to stay healthy, active, and confident in their choices. Share this video with a loved one or caregiver, and let's build a safer, smarter approach to senior nutrition together.